What do these three people have in common? At first, you may think that these are just characters in famous movies, but one thing that connects these three especially is that they all show signs of Cluster A personality disorder. Cluster A personality disorders are a group of mental health conditions characterized by odd or eccentric behavior, thoughts, and emotions. The three types of personality disorders in Cluster A are paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. People with paranoid personality disorder tend to be overly suspicious and distrustful of others. They may have a tendency to interpret others' actions as hostile or threatening, even when there is no evidence to support this belief. Unjustified beliefs that others are trying to harm or deceive you, perception of innocent remarks or non-threatening situations as personal insults or attacks, recurrent suspicion that your spouse or sexual partner is unfaithful are common symptoms of those with PPD. The media portrayal we chose was Macbeth. Macbeth shows symptoms of PPD as he desperately clings onto power and is overcome with suspicion and distrust of those around him. This is reflected in his actions as he goes on a frenzied murder spree to cover his tracks and ensure his place on the throne. He also employs spies to keep tabs on all his lords, and he even kills his best friend Banquo in the process. His willingness to kill his friend shows an emotional detachment common in all Cluster A personality disorders, and he also shows eccentric behavior in his speech and actions. Some may confuse PPD with paranoid schizophrenia, when in reality they are two different disorders with different diagnostic criteria in the DSM-5. These two ailments share comparable indications, including the desire to distance oneself from society and a preference for being alone. However, individuals with PPD often do not experience hallucinations, which are a crucial characteristic that distinguishes them from those who suffer from schizophrenia. Those with PPD have a distorted view of reality, while those with schizophrenia are entirely disconnected from it. Furthermore, PPD affects about 0.5 to 2.5% of the population, while paranoid schizophrenia affects about 0.25 to 0.64% of the population. People with schizoid personality disorder, or SPD, tend to be socially withdrawn and indifferent to the opinions and feelings of others. They may have a lack of interest in social or personal relationships, which makes them prefer to be alone. They may also have a limited range of emotional expression, an inability to take pleasure in most activities, and an inability to pick up normal social cues. Our example of someone with SPD is Iron Man. Just kidding, it's Sherlock Holmes. In the following movie clip and in the novels themselves, Holmes demonstrates many symptoms of SPD. Sherlock has a consistent penchant for solo hobbies. Investigating crimes was a rather solitary occupation for him. Most of his tasks were solo before he started working with his partner, John Watson, which demonstrates a lack of interest in social or personal relationships. Furthermore, as noted by characters in the story several times, Sherlock has very few friends. When Sherlock is working out crime scenarios in his head, he must utilize his imagination to visualize the numerous possibilities in a logical manner. People with SPD that meet this criterion frequently describe an interior world that is vibrant, rich, and curiously well organized. Furthermore, he never married and only had one canonical love interest, which shows a disinterest in socialization and sex. SPD often gets confused with schizophrenia when they are completely different mental health conditions. SPD is not a psychotic disorder, which puts it in a different category than schizophrenia. People with SPD also do not experience hallucinations or delusions, but it is possible that people with SPD are at risk of developing schizophrenia as they share some symptoms such as a want for social withdrawal.
Schizotypal personality disorder, or STPD, is a mental health condition characterized by a pattern of odd or eccentric behaviors, thoughts, and perceptions. Symptoms of schizotypal personality disorder usually include odd beliefs or magical thinking, such as believing in telepathy or clairvoyance. Individuals may also dress in unusual ways and have unusual mannerisms, often having a peculiar speech pattern or using unconventional words or phrases. As with other cluster A disorders, individuals may have difficulty forming and maintaining close relationships, feeling uncomfortable in social situations, and preferring to spend time alone. People with STPD may also have strange perceptual experiences, such as seeing or hearing things that are not present or experiencing bodily sensations that others do not.
If you had to choose only one half of your son, which one would it be?
What kind of a question is that?
No need to snap. Just a question.
A character that exhibits symptoms of STPD and screams eccentricity is Willy Wonka. Not only does he wear an outrageously purple suit and live in a chocolate factory, Wonka also displays peculiar thoughts and cognitive patterns, such as his belief that whipped cream must be made by quite literally whipping cream with whips. Wonka's use of made-up words and odd speech patterns are also indicative of the disorder. Moreover, he is unbothered by the fact that children are getting hurt and potentially dying in his factory, and has a limited social life, with no close friends or confidants besides Oompa Loompas. He also avoids interacting with people his own age due to excessive social anxiety, is disgusted by physical touch, and has an easier time interacting with children. These behaviors and symptoms are reflective of schizotypal personality disorder, though he is not officially diagnosed. People often confuse STPD with schizophrenia, as they share similar qualities, though STPD is much less severe. Those with STPD may experience unusual perceptions, but do not typically have the severe symptoms associated with schizophrenia, such as hallucinations or delusions. In a nutshell, individuals with STPD have a distorted view of reality, while those with schizophrenia are completely disconnected from it. There is also a common misconception about people with STPD being violent, but there is no evidence to suggest that they are more likely to harm others than people without the disorder. Because these three personality disorders are all in the same cluster, causes and treatment are very similar across the board. The exact causes of the three type A disorders are not fully understood, but it is thought to be a complex mixture of genetic, biological, and environmental factors. Studies have found that individuals with a family history of schizophrenia or other related disorders are at an increased risk of developing SPD and STPD. People with type A disorders may also have abnormalities in brain structure and function, particularly in areas of the brain that are involved in social cognition and perception, which include the medial prefrontal cortex, temporal pole, and posterior cingulate cortex. These abnormalities may contribute to the unusual thought patterns and perceptions associated with cluster A personality disorders. Lastly, traumatic experiences such as abuse or neglect during childhood may also increase the risk of developing STPD and SPD. Environmental stressors such as social isolation or difficult life circumstances contribute to the development of these two personality disorders. Treatment for these three disorders typically involves psychotherapy, which can help individuals develop social skills and learn how to cope with feelings of isolation and detachment. Cognitive behavioral therapy may also be helpful in addressing negative thoughts and behaviors that contribute to social isolation. Antidepressant medication may also be prescribed to alleviate symptoms of depression or anxiety that may co-occur with these disorders. However, one thing that is different with schizoid personality disorder when compared with PPD or STPD is that individuals with schizoid may not seek treatment as they do not typically experience distress from their condition, so treatment may not be necessary or even desired by the individual.
In conclusion, those suffering from cluster A personality disorders may experience difficulties with social relationships, emotional expression, and communication. They may also have distorted beliefs or perceptions and may struggle with anxiety, depression, or other mental health issues. 3.6% of the general population are diagnosed with cluster A personality disorder, so the next time you see someone acting eccentric, don't call them crazy or think that they are merely seeking attention. It is important to understand the boundaries of these individuals and not force them into situations they are not comfortable with, even though you may think that you are being friendly. Cluster A disorders are complex and not the easiest to understand, so being patient and wary of potential triggers or symptoms are essential when interacting with those with personality disorders.